If your plasma has arrived and it hasn't been immediately placed into the freezer, but instead left out at room temperature or in a fridge and has been allowed to thaw, there's a good risk, a good chance that the clotting factor activity will be lost. So my advice is that that plasma should only be used for its antibody activity, not for its clotting factor activity in a case of a coagulopathy of some sort. If you thaw a bag of plasma and you're unable to use it, and you try and refreeze it, once again you'll lose the clotting factors. So therefore I would still recommend refreezing it, but saving that plasma for a case when you need the anti-endotoxemia activity or the anti-parvovirus activity or the anti-distemper activity. Just don't try to use it on coagulopathies. Clotting factors do not survive a freeze-thaw cycle. They're quite stable for up to 4 years while frozen, but if you thaw the plasma, they start to decompose within about 6 hours. And if you try a refreeze on that, you will lose clotting factors. It's not a good idea to give plasma along a saline drip. There is a chance that sterility has been breached, especially in a septic patient if there's been some backflow of blood, and we don't want to risk that. So it's best to give plasma through a dedicated line. A blood giving set is an absolute necessity when you are transfusing plasma. Whenever you thaw frozen plasma, whether you can see them or not, there are small fibrin particles present in the plasma, and these all have the capacity to cause an embolism. The most likely place for an embolism to occur is in the lungs or the brain, neither of which is a healthy situation. So you must use a blood giving set for plasma transfusions. Oral administration of plasma is fine for newborn pups. It's also okay to use it in cases of acute parvovirus, because the parvoviral antibodies in the Caniplas may limit the damage that any free parvovirus that's living in the intestinal lumen can do before they invade the intestinal villi. Otherwise, it's best to give Caniplas intravenously. In small pups that are older than 24 hours, subcutaneously is also okay. Subcutaneous injection of Caniplas works okay. It takes up to 24 hours though for the antibodies to arrive in the circulation. So your therapeutic effect is going to take a bit longer to occur. However, in very small pups that are older than 24 hours where you can't cannulate a vein, that may be your only choice. Caniplas routes of administration start at subcutaneous, intravenous. Intravenous is always the preference. You can also give it intraperitoneally, and you can use it orally in newborn pups. There's a wide range of conditions which can be treated with Caniplas quite successfully. They range around endotoxemia, and they go on to sepsis and coagulopathies, plus multiple bleeding points and other metabolic conditions like acute pancreatitis. So we're dealing with parvovirus, garbage gut diarrhea, acute hemorrhagic gastroenteritis. We're also dealing with gastrointestinal emergencies like GDVs, intussusception, torsions, twists and obstructions, pyometrin, prostatic infections in dogs, heat stroke. Coagulopathies would consist of rat sac ingestion, von Willebrand's disease and envenomations. You've got failure of passive transfer in pups, fading puppy complex in older pups, motor vehicle trauma, and finally acute corneal ulcers. If your Caniplas is thawed upon arrival, the first thing you should do is place it in a freezer. But you should also contact your veterinary wholesaler, because they are very clearly instructed that they've got to pack the Caniplas in such a way, A, that it arrives frozen, but they must also ensure that they have a courier utilised who knows how to get it there promptly. This overnight delivery and leaving it in the sun outside the vet clinic is just not on, and these wholesalers should be held accountable if that happens. No. The approved shelf life for Caniplas is 30 months. In other jurisdictions, such as New Zealand, we have an approval for 36 months, but the Australian shelf life is 30 months. Medico-legally, you are taking a risk in using expired product. If there's any floaties present when you thaw your Caniplas, any visible floaties, this is the reason why we specify that a blood giving set must be used when you transfuse Caniplas. These little floaties need to be filtered out during the transfusion process, and if you don't filter them out, you run the risk of an embolism occurring somewhere in your recipient animal, most likely the brain or the lungs. There are some specialist centres that use Caniplas to treat immune-mediated disorders, and basically it's the anti-inflammatory properties of conferred by the E. coli antibodies in Caniplas that they're mostly after. Immune-mediated disorders are mediated primarily by the inflammatory mediators in the body, and the most serious inflammatory mediator and the first to appear on the scene in the largest quantity is tumour necrosis factor alpha, and Caniplas has been shown to have good activity in neutralising TNF alpha. Small dogs receiving Caniplas transfusions are a bit of a challenge, mainly in getting a good catheter into them, but canine plasma, which Caniplas is, exists naturally in all dogs. Therefore, a plasma transfusion is probably the most physiologically friendly transfusion that you can give a dog. You cannot overdose a dog with Caniplas. The important thing though is not to cause fluid overload, so your rates of administration must be kept lower if you're intending to transfuse a larger volume. The dose rate of Caniplas is 10 to 20 mils per kilogram of body weight, or 20 to 40 mils per kilogram of body weight in young dogs. I quote a range in this situation because you use the higher end of the range for the more seriously ill dogs. It just makes common sense. But if you were to give 3 200 ml bags to a 20 kilogram dog, you would not do that dog one iota of harm, as long as you took 4 to 6 hours to administer it. You wouldn't want to try and deliver that in 1 hour. Common sense would dictate that.